Kuhn, and I will be moderating today's presentation. I am here with Samantha Forehand, who is our Marketing Communications Manager, and she will be presenting today's webinar. Before we get started, I do want to address just a few quick housekeeping items. First of all, we will be recording today's presentation, a copy of which will be sent to all attendees, along with a copy of our presentation slides and a certificate of completion. You can use that certificate of completion for any type of professional development purposes you might have. If you have a question at any point during today's presentation, feel free to ask it by clicking on that questions button at the bottom of your screen. We will dedicate time at the end of the presentation to answer all those questions, but you may ask them at any time. And finally, if you need to adjust your sound or your display settings at any point throughout the presentation, you can do so by using the buttons in the upper right and left corners of your screen. With that, we are ready to begin. I will turn the presentation over to Samantha.
Well, welcome everybody to the webinar, Get to Know the RealCare Geriatric Simulator. We are very excited to be hosting this webinar today to introduce you to one of our latest simulators that we launched late last year and show you how you're going to be able to use this in a program that you are currently running. So today what we're going to discuss is we're first going to go over who is Realityworks. We are an experiential learning company providing products and programs for education, and we want to help you get to know us a little more. Also want to cover the need for geriatric training. We know that the baby boomers are getting into retirement age and there is going to be a higher need for trained healthcare workers. And so we saw that there could be a need for geriatric training supplemental tools. We'll then jump into introducing you to our RealCare Geriatric Simulator, along with showing one of our colleagues wearing the simulator, and then go over the curriculum that comes with the product and show you some of the key lessons that you could use within your programs. And finally, we're going to go into some of the creative ideas that we have heard from our current customers on how to really get a full program going with the simulator. So first of all, who is Realityworks? We have a mission to create learning experiences through products and programs that enable educators to show probable outcomes of behaviors and choices. We specialize in experiential learning tools, really the learning of reflection through doing. So we want to look for those educational tools that can complement programs to help students really understand how their behaviors and choices could affect their future, whether that be within the workforce or be for decisions they're going to make for their future as well. We have an educational focus. We like to combine hardware, software, learning aids, and curriculum to really give a real-to-life experience. We look to have products that are going to fill a need, make that real-life experience, help with the skills gap, help with those future choices that students are going to have to make. Within education, we have been around for over 20 years. All of our product lines are in 67% of school districts in the US, and we have distributed products in over 90 countries worldwide. And to date, we are just over 6 million students that we have served using all of our products. So the Realityworks programs that we offer are both the RealCare line and the RealCareer line. So we look to bring different products within these lines that are going to complement areas of career and technical education or general education in both the secondary and the post-secondary areas. Our RealCare line of products bring experiences across the lifespan. This is where we have infant simulators and different models that focus on family and consumer science, health education, health occupations, nursing. Some of the key skills learned from our products are parenting, infant care skills, child abuse prevention, and most recently we brought the geriatric simulator into the RealCare line. For our Real Career programs, these programs really focus on employability skills and career exploration. We have products within welding education, products in business education and agriculture, we saw a need for filling some skills gap. For example, the welding simulator. We saw that there's definitely going to be a skills gap in the future, a need for more students to enter that area. And we thought bringing on a simulator would help engage those students and get them involved in those programs and make it fun and see that this could be a career path they could go down. So really the Realityworks programs look to engage future students, engage future workers, and also give some of that hands-on real-to-life experiences. So you might be asking yourself, why a geriatric learning aid? This was a new area for us last year, but we saw that there could be a need for a supplemental tool to engage and educate students, aid in the education of healthcare workers, to get them involved in this program and really give them some of those key skills needed for patient care, empathy, compassion. There is a growing population of the elderly, and there is going to be a need for more healthcare workers. So by creating a simulator for the geriatric field, we saw that we could help with some of that patient care experience and some of those key skills that are needed. So the geriatric population is increasing. It is something you're probably all well aware of. And according to the Bureau of Labor Statistics, the number of elderly people in the United States will be at its highest over the next decade and will continue to grow. This will ensure a sustained growth in careers in geriatrics and gerontology, which is expected to grow by 20% through 2020. We see that there is going to be this rapid increase, and there is going to be a huge demand for workers within nursing, CNA, home health care aides. And in fact, another study by the Bureau of Labor Statistics shows that many of the occupations projected to have the largest growth involve those geriatric patients. So from 2014 to 2024, the projection are that the 18 most growing career areas, 6 of those are in the health occupation related areas, the top being personal care aides, registered nurses, home health aides, nursing assistants, and etc. So there is definitely enormous potential for this career area for students to get into. And with this rapid growth, we wanted to look at how can we help get those potential workers skilled up and give them some of those right skills they would need for that patient care. And if you look at those top 10 skills that are needed for working in a nursing home, most of them involve direct patient care. This is a term we're really emphasizing, is how can we help with that direct patient care? And we believe that better care will be provided when workers are sensitive to what their patients are actually going through. Compassion and understanding, these are key to providing care for geriatric patients. And if you give those students, those potential workers, a chance to really walk in the shoes of an older adult, they will be much more likely to provide that appropriate care because they'll have a little bit more of an understanding of the challenges and understanding of those daily simple tasks the patient might have to go through. And by using a simulator, they kind of get that experience. And this is really where we saw that we could help fulfill that need. We could create a learning aid to give those care skills, to create compassion and empathy, and complement what you as educators are already doing to prepare these students for the workforce. We saw that we could have a supplemental tool that's going to add to those needed skills for geriatric care workers. So why a simulator and why not some other aid in per se? We looked at a lot of statistics, and stats show that those that have gone through an age simulation experience, that 83% of those were able to empathize more with the life of an older adult after participating in an age simulation. And 95% of those had a better understanding of those physical conditions of aging after going through this experience. And we looked at this and thought that simulations are a really great hands-on way to get an understanding of something in life, where you can actually engage with it and get that hands-on experience and gain some skills faster. For example, we're well known for our RealCare Infant Simulator, a simulator that students would take home for them to get an understanding of what it's like to be a parent. And with that, we saw through studies that having that infant simulator really opened up some communications with parents about what it would be like to be a teen parent. On the flip side, when our infant simulators are used in a nursing setting, it gives a little bit more empathy for that nurse who knows they're sending home a baby with a new parent, so they can get a little bit of understanding what that patient or that future parent is going through. And with the geriatric simulator, we related that just the same, and that those future workers are going to be able to empathize with their patient a little more, understand the common ailments, and be trained up and prepared to work with them. So that brings us to what our simulator is. So introducing the RealCare Geriatric Simulator. This is a sensitivity suit that we paired with an activity-based curriculum for a full geriatric experience. We see that the simulator will help participants understand some of those common physical effects of aging, while gaining some empathy as well. So the geriatric simulator simulates several different common ailments and physical conditions. First of all, visual impairment. The simulator comes with a set of 6 glasses with various visual diseases, where the students can try it on and understand what glaucoma looks like and what that patient might be going through. Restricted range of motion. The simulator comes with elbow restraints and knee restraints, so that range of motion is a little bit more difficult. So you could have your student walking around with that and seeing how hard that motion actually is, and that decreased mobility. There's a weight vest that the students put on, which over time is going to stoop the posture and cause some fatigue. Loss of sensation in the hands. We actually have a set of gloves that you wear, and the fingertips have less sensation. It's harder to do things. It's harder to open a pill bottle. And just overall, the full suit is going to decrease the sense of balance. The student's going to feel a loss of strength. And by having each of these parts and pieces, they can kind of get that understanding of what the body would feel like in the geriatric simulator. So wearing the simulator. It is several parts and pieces that come with it. And the great thing about that is if you wanted to just do a lesson on decreased mobility, you could just use the knee restrictors and the elbow restrictors, and you could do some lessons on that or some activities based around that. Or you could have the student wear the full simulator and actually go through several different lessons for a length of time to get the full experience. It's very easy to put on and take off. It has separate components, and we have lessons for each or for the full experience. And what we're going to do now is go to our video and show you one of our colleagues wearing the simulator and have her do some of these activities for us. Okay, so this is Andrea, and currently Andrea is wearing that weight vest, and she has the elbow restraints on and one of the wrist weights as well. And so what we're going to do is actually have her put on the gloves for that loss of sensitivity. So it's something that Andrea could be putting on herself, or if you had a group setting going on, you could have a partner doing it with her. She has one wrist weight on, but I'm actually going to put the other one on for her. And the simulator does come with 4 wrist weights. So what we recommend is maybe if you have a larger male student, you'd have him wear all 4 of them. If you have a smaller student in stature, maybe you would want them just to wear 2 of them. So that's what we have with Andrea right now. And then she does have ankle weights on as well. And then it also comes with a cervical collar. So it just goes around here. This is going to help with that decreased mobility sensation. Excuse me, Andrea. Now you can see that Andrea is wearing the full simulator. And then it also has the glasses, but we're gonna have her do an exercise first before we have her put the glasses on, just to show you how you could use parts of it or use the full thing. So first, we're just going to a simple task. It's just a jacket that Andrea has to put on. So if it is laying there, so she has her restricted range of motion, picking it up. So with this, you could have the students going through this, watching her do this. It's difficult for me if I were the caregiver or if I were the CNA or nurse. I really want to help her, and I'm almost getting a little frustrated, like, oh, let me just do it for you. That's almost a lesson in itself for that other student who isn't wearing it, getting that compassion as well, that patient care. So Andrea got that on. And so the next activity we're going to have her do, we're actually going to take the glasses. It is a case with 6 different sets of glasses. And for Andrea, we are going to have her do glaucoma. So you can see that there is a different film on each of the glasses to actually simulate the different eye conditions. So have Andrea put those on. And then another simple task is we're just going to have her open a Band-Aid. Should be pretty simple. But for Andrea, now she has that visual impairment. So she has to try to do that. She also has the sensation gone in her hands. So it could be a very difficult task. And she got it open. So this is something you could do in your classroom. You could have the students wear the full simulator and do each of these activities. Activities are suggested within the curriculum. Or else you could have them do just a visual impairment lesson. And then you could have them do just a mobility lesson, and so on. So thank you very much. Other parts that come with the simulator is you do get a walker with it as well. A lesson you could do with this is if you were on a post-secondary campus or even within a high school, you could have the students go across campus with the walker wearing the simulator, and feel what it's like to have that additional piece. They could also get some reactions of people around them, have them drop something, see if somebody comes up and actually helps them open a door as they're trying to get into the next building. You're also kind of getting that community reaction, not only for the person wearing the suit, but kind of what's happening around them as well. And then the simulator does come with a carrying case as well. The full simulator fits in here besides the walker. So what we're going to do is just jump out to a video that we have so you can see somebody using the walker and wearing the full simulator. So if this is difficult to see, you may need to make your screen full screen. But you can see here, this is one of our colleagues, Andre. He has the full suit on with the walker. He's doing a simple task of walking in the front door with the walker in the simulator, and now he has to go up steps. So after this, he described how difficult it was to walk up 5 stairs, carrying that walker, trying to use that as an aid as well. So he got a true understanding of empathizing with somebody who has elderly ailments as well. A really interesting thing that when Andrea and I were going through the glasses earlier is she tried on the glaucoma glasses and simply said, oh, this is what my grandma went through. She always said it was a little dark. And so just that simple statement shows you that people kind of get it. They understand what a family member is going through if they're doing a family studies classes, what a patient's going through, and so on. It was a really enlightening moment to see how you can engage somebody with some simple tools and learning aids. So the Geriatrics simulator can be used in several settings. We have seen many different areas purchase this and integrate it into programs. It was designed for high school students to be used in health occupations classes, psychology of the lifespan, or even human development classes. Within post-secondary, we see it in healthcare classes, nursing classes, the study of aging, several different areas where you can provide those hands-on experiential learning lessons to make those memorable. CNA training courses have adopted this within community college or in on-site nursing homes. If the workers need additional continuing education hours, the simulator is a great thing to add in to give them that empathy training, while also that patient care training as well, to get those additional continuing education classes. With public health organizations and community educations, this is a great way to engage your community or the general public to learn a little bit more about geriatric issues. Also, it's a way you could get some attention for your program. If you had it in your post-secondary course and you wanted to get the local community to see how you're training the future workforce, having your students out in public wearing this is going to educate the community on the benefits of this education area as well. So the geriatric experience curriculum comes with the simulator as well. This is a 9-lesson curriculum, roughly 9 to 13 hours of teaching time. We offer this online. It has slides, presentations, a pre and post assessment. Some of the topics it goes over is geriatrics and gerontology career exploration. There is a full lesson on visual impairment. That's where those set of 6 classes will come in. There is a lesson on cognitive changes of aging, and then a lesson that accumulates all of this with the full suit and full experience, and several hands-on activities as well. Our curriculum is aligned to several national standards, Common Core state standards, Common Career and Technical Core standards, and National Health Education standards. All of that information is available online for you to download if you're interested in any of the standards that the curriculum is aligned to. We did want to dive a little bit into a couple of the key lessons. Lesson 2 is on visual impairment. This lesson goes over the 6 different common conditions that older adults face. So the set of 6 classes cover glaucoma, macular degeneration, cataracts, diabetic retinopathy, retinal detachment, and retinitis pigmentosa. So what the students would do during this lesson is they would try it on, identify the different impairments, would do some of those activities, and then would reflect on how they felt and how it was going through those activities. Throughout each of our lessons, reflection is really important, because that's when students are going to be able to communicate what they felt, which is going to help with that compassion and empathy training. Lesson 7 is the geriatric experience. This lesson begins with an empathy self-assessment, where the participants can reflect on how empathetic they think they are and what areas that they would need for improvement. They then would put on the full geriatric suit and go through some of those different tasks, including opening a pill bottle. You could do buttoning a shirt, picking up coins, tying shoes. Some of those simple daily tasks that they would go through, and then they would do a reflection activity again after this, where they could talk about how they felt about going through the simulation experience, how their attitude has maybe changed to somebody who's going through this as well. So this is a lesson where the full suit would be used as well. So creative ideas by innovative teachers. There's a lot of different ways that you could use the geriatric simulator. Hopefully you're coming up with some ideas as you're listening to this webinar, but we had some key recommendations and ideas from our teachers that we wanted to share as well, as our educators are the best people to teach us on how these products can be used. The first recommendation that we've heard is to have your students wear it at least 20 minutes, even up to 60 minutes. As you think about it, the first 10 minutes somebody would be wearing this, it might still kind of be fun. They might be talking about it with everybody around them. Oh, this is what I'm feeling. But it might not really be hitting home yet. After 20 minutes, maybe they're going to get that stooped posture from that heavy vest. After 30 minutes, that's when the fatigue's going to set in. So now they're really starting to feel everything. And when you do it for a longer period of time, you're going to be able to have them do more activities. You could do the activity where they're going to walk around a campus with a walker, getting that community engagement, but also really challenging them to a daily task that one of their future patients could be going through as well. The next recommendation we have is group experience. Anytime people can experience or do an exercise together, it's really going to help enrich that conversation. They can compare how each other is feeling and interact with one another. They could do the tasks together. You could have them both using a cell phone or reading a newspaper, tying a shoe. So as they're going through those things, they can kind of compare what they're feeling. We recommend, if possible, that groups of students wear the simulator at the same time together. But if it's not possible where you would have multiple suits, another way you could do a group experience is you could set up stations around your room. One station would be with the weight vest. The next station would be with the ankle weights and the wrist weights. And you could have them do different activities with each piece, but doing it in a group setting still. So they're still experiencing with that with other students, and being able to kind of compare and reflect with one another on what they're feeling. Patient practice. This is a new one that we heard from one of our post-secondary customers, is that the geriatric simulator is great for the person wearing it, where they can reflect and empathize, but it's also great for that other student that's helping that person who's wearing the simulator do different tasks. So what they do is they create a setting of a hospital room or a nursing home room. One student wears a simulator and the other person would play the CNA. They would practice with the student, helping them sit down in a chair and stand up, helping them lay down in a bed and stand up. And while the student who's playing the patient is getting the feeling of the elderly, the CNA is getting the realism of nursing. They're gaining some patience. They would be working on their communication skills. Really those key skills we talked about for best patient practice. So it's great to engage the students not wearing it as well as the students wearing it. And finally, we've said a few times a key thing is the reflection period. This is in a lesson within the curriculum, but we just think it's a great way to get people to reflect a little bit more is after 20 or 30 minutes of wearing it, they actually write down what they felt, how their attitude changed, what the experience meant for them for their future career. Reflection is a great way to really engage them and learn about the empathy for those patients that they've gained through this experience. So the RealCare Geriatric Simulator. Just to go back, what are the parts and pieces you would get with a program? The kit includes that 9-lesson curriculum that we talked about that is available online. Along with that curriculum is you do have a guide that shows you how to put each piece on. And so a student could pick up that guide and learn how to use it very simply. The kit also includes the weight vest that is adjustable and one size fits all. It has 2 ankle weights, 4 wrist weights. As we discussed earlier, you could have a student wear 2 or 4 wrist weights, 2 elbow restraints, 2 knee restraints, a set of those sensitivity gloves, a cervical collar, a set of 6 visual impairment glasses in a case, the walker, and then a storage case as well. One geriatric simulator cost $24.99 for each. If you were to purchase a larger set, a set of 5, there is a discount built into that as well, which we could get you pricing on that if you were interested. Just some additional information. If you were interested in learning more about Realityworks or other programs that we offered, you can visit our website. For attending this webinar today, we wanted to give any attendee $100 off the Geriatric Simulator. You just simply go to realityworks.com/geriatric. There's a form on there, fill that out, and we'll get you that $100 off. And additionally on that page is going to be the full video of the one we viewed earlier, if you wanted to share it with anybody. We also have a great blog where we have different industry tips, different highlights of products and so on. That is great if you wanted to engage with us further. So now we will open it up to questions.
All right, thanks, Sam. We do have a few questions and comments from our attendees. First of all, Lauren, who points out that her interest is in a nursing rehabilitation course, shared with everyone that the simulation suit, it looks like it allows a safe environment for students to experience these skills. Thank you, Laura. That is a great point. That is certainly a benefit of the simulator. Karen also pointed out that this sounds like an awesome lived experience for her students. So thanks for that, Karen. That is precisely what we think as well. Linda would like to learn, how easy is it to clean the suit between students?
What we have heard from some of our current customers, I bring up a high school classroom because they always want to keep their items clean going from student to student.
Sure.
Is they can just simply wipe it down with any of the like the Clorox disinfectant wipes. You could wipe it that way. The vest weights actually do come out of the vest, so if you needed to put that through the washer, you could do that as well, along with the gloves or the knee restraints and so on. So it's very simple to clean. Of course, with the glasses, we highly recommend you disinfect them in between each student as well. They are a set of safety-like glasses, so those are easy to wipe down.
Perfect. Okay, thanks, Sam. Karen is wondering, are the simulation wraps weighted, and what are they made of?
The actual weighted, the wrist weights and the ankle weights are weighted. The knee and elbow restraints are not weighted. So they are made of a nylon polyester fabric that would be tied around. Well, the vest is made of more of a neoprene type fabric.
Okay, fabulous. Jamie is wondering if it's possible to purchase the set of glasses only.
The set of glasses are only available in the full simulator at this time.
Okay, good to know. Thank you. Laura's wondering if there's any latex ingredients.
That is something we are going to have to look at. I'm looking at the labels right now, and when we forward out this presentation, we will let you know if there is latex involved in any of this. I do not believe there is. I believe that was something we had looked at early on, but I will confirm that and add it into the email that goes out.
Okay, sounds good. At this point, we do not have any other questions or comments to share. So we'd like to thank everyone for spending some time with us today, getting to know our RealCare Geriatric Simulator. If you wish to learn anything further, feel free to utilize the resources that you can see on your screen now, or you may contact us, of course. We can be reached via email at information@realityworks.com or by calling the number on your screen, 800-262-3806. Thank you again for participating today.